Morning, Joey. How you doing?
I'm doing pretty well.
Yeah?
I'm doing pretty well.
What level are you at?
You know, my Atlantis is still at 11, which is really good.
What was it before?
It was 13.
And the highest?
The highest was 14. So it's really come down.
How long have you been on the meds?
Oh God, it's at least 8 years. So it's really doing well, and you know the short-acting one is still doing better. So I'm able to use a lot less short-acting. So I think, you know, at this point, we're really able to keep it stable. So I'm using the goat milk. I'm using the goat cheese. I'm using the spirulina. I'm not able to, you know, get as much powder, spirulina powder.
You're gonna do the tabs, right?
Yeah, but I'm doing the powder as well, just not, you know, as much. But you know, really feeling energetic, and we're getting there. We're really getting there.
Thank you. I appreciate it. Now, one of the privileges I have is that you were my professor almost 30 years ago.
Yeah.
And and it seems to be my staying in life right now, because before you I was treating my other professor from sociology at the UH University, and I think you're fighting me more than he did. So but you're not going to win.
No, I know. I gave up. I gave up the fight. I'm in there. I'm doing it. It's just you know,
it's a challenge.
It's a challenge. It's a challenge, and you know, it's not the easiest thing to think about changing. You know, type 1 diabetes isn't easy. You know.
Also, since most people believe that you can't change.
Right.
And unfortunately, even though you have the background of Eastern medicine and the philosophy that goes with that, when you're compounded with Western medicine and all they say is do this and there's no other way,
right,
and they give you no hope,
yeah,
is when the real challenge.
Yeah.
That
even when, you know, I have a mindset from the 70s of not believing anything, you know, that's normal. Mm-hmm. Even still, it's a hard thing to swallow that you can change something that's directly opposite. So here I am. I'm opening my mind to everything. I mean, I totally believe in energetic healing. And, you know, anything is possible in our bodies. Absolutely believe that 1,000%. And here you are, you know, making things happen on that level. Whatever we want to call it, it doesn't matter. But, you're able to make that process happen. Whatever we want to call it, whatever name we put it on, something in you is directly different. So we give it grace. And it's a fairly miraculous process because, you know me, tried everything, you know, other than taking the goat and burning it in the courtyard.
That was last week.
We
were there.
Not burning the goat. That was my limit. But you know me. I've gone everywhere and tried everything, and things are changing for me, and that's fairly miraculous.
Well, I can't take the credit because
I
actually learned it from this short person sitting next to me on what to do.
Well, you learned a lot from me, but you didn't learn this from me.
Well.
No, what you're doing at this point, you didn't learn that from me. Had you learned that from me, I would not be in the space that I'm in. So this is something different that you bring to the table.
Thank you.
So.
I have a philosophy only because my daughter was a leukemia patient.
Yeah.
And I want to express it with everyone is you may have been born with it, that's okay. You may have gotten through a genetic coding, that's okay. But it's acquired condition. Yeah. And I tell all my patients that if you acquired it, you can always give it back.
Yeah. Oh,
We good? Ta-da! How's that?
that was awesome.
You were great.
Well,
We're done.